for being a little bit of housekeeping. I'm going to take a few minutes to welcome everyone. Take time to participate in the poll that's going on. We are recording this session, so if we have your email address, we will send a link out with the PowerPoint slides as well as a recording of the video. So every week since March 31st, the Emory Alzheimer's Disease Research Center has been providing you with these weekly 1-hour sessions. And the content is really around brain health. And as you know, what's good for your brain is good for your heart, and what's good for your heart is good for your brain. So we begin every week with the exercise demonstration. So John Lewis gives us about 8 to 10 minutes to get us moving, get our hearts pumping, and get us going to start the session off. So we try to pack a lot in under an hour. So if this is your first time joining us, this is your time to go get a notepad so you can take lots of notes. We are a research center, so our primary goal is to ultimately find a cure for memory disorders. So even though you'll hear from a variety of resources, we really want you to, to help prevent you from getting Alzheimer's disease. But if that ultimately is the case, then we are an accredited center, and that's what over 40 of our clinical researchers are doing every day. They are in pursuit of a cure. So if you have questions or comments, you can post those in the chat. Again, exercise at your own risk and heed the advice of our experts. But again, your first line of defense is your primary care doctor or your specialist. So make sure that if something comes up and you have a question or a concern, you are going to the doctor. Even though we're in COVID, we still strongly admonish you to participate and engage with your primary care doctor, your health specialist, even your therapist at this point. I mean, we're still under a lockdown. We're in a shutdown. COVID is still happening. And so we want to make sure you're aware of things that you can do to take care of yourself, because we want you to be empowered. We want you to be informed, and we want you to stay engaged with us. Even though we can't be with you in person, we hope these sessions are meaningful and that we are being a resource for you during this time. So I think with all that said, as I mentioned, you're going to hear from Dr. Monica Parker today. She's going to be talking about the research process, the engagement, and what are we doing now as a center during this pandemic. Then you're going to hear from Rebekah Davis with the Alzheimer's Association. She's going to be giving you great and wonderful information from our Georgia chapter. And then finally, you're going to hear from Erika Henderson. She is with Good Samaritan. So she's going to be talking about the services and resources that they have available as well. Okay, so all that in under an hour. Again, welcome everyone. And with that said, I'm going to turn it over to you, John. Thank you.
Yes, yes. And before I get started, I wanted you to know, if you're having a little stress from being isolated a little bit, just go get you a regular little pot, put you some herbs in it, get some regular topsoil, and guess what else you need? Only a little bit of water. Just to relieve that stress and making sure you just making something come alive and watching it and seeing it grow can help with the mental. So only thing you need is a pot, a little dirt, and any herbs that you need, and you can make it happen. All right, so do you have your chair? You have your water bottles? We're gonna warm up that body. Here we go. There we go. Here we go. Get your water bottles up. Let's go. Here we go. Keep going. Here we go. Come on now. Bring it down. Bring it down. Come on, give me that back. And over. Here we go. What? Come on, come on. There we go. Up top. Come on. Give me the 5 tail. There we go. Right ahead. Come on, don't be stopped. If you need to take a break, take it. Stop! 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 Watch it. Stop. Pull it. Pull it. Let's go. Get him out. There we go. Get on. Get back up. Get right up. Get over. Get back up. Get Good job. Take a little short breather. Get your broom or your stick, your cane, whatever you have. We're about to work it now. Here we go. Hold it out front. I want you to stretch. Pull.
That little bringing buzzing on nothing falling your heat.
Come on.
Directions to the party that's just started with that coping. That old school radio station is just driving till it's fading.
There we go.
Tonight.
All right, here.
Just letting you do that thing right there, flipping your hair, baby.
Get that back strut. Come on.
Casey's baby kick come to the floor.
Give me the shoulder.
Bobby pins on your hair, girl, you don't need them no more.
There we go.
They're singing on your shoulder as you
Go.
Go.
Go. Let's go. Come on. Go. Go. Hold it out front. Can I get that waistline? Hey! Good job. We have worked that upper body and that waist. Now I'm gonna get a little bit more cardio in. Let's get it going.
And I fly, I broke down and I cried.
I need to get that waist. Come on. I didn't need you rocking with me. There we go. Come on. Let's lose some inches off that waistline. Come on. Can I get a little twist?
Gonna be crazy, gonna be wild.
Oh.
I'ma have a little bit of this child. No straight.
We crunching that side over. There we go. Other side. Come on.
Every kind of losses you can't find, but I got one.
Keep twisting. Let's go.
Every kind of guy, girl, mamas don't lie.
Bill. Come on. Let's go. Give me that waistline. Come on. Pull it.
pain, but just patient while I change. Even cross your mind to walk away.
Out the way!
Getting crazy, reckless and wild. Acting like my mom said, this child.
There we go!
Took a heart like yours to find this place.
Get him up!
I've been at the wrong place at the wrong time.
There you go!
The wrong things most of my life.
Good job!
Since you can't find.
Woo! I done worked up a sweat. We gonna keep it going.
Right now, I
This
just
is
need
my
you to
favorite
get
song.
ready.
Get this, everybody.
Get
Come on.
comfortable. Grab your loved ones.
Grab your loved ones if you want
Or
to.
grab your love partner.
Hey,
If you're by yourself, no worries.
we're gonna have fun.
Delete. Come do the first thing. And tell what the sweet heart it's been out with. Go down and get lost.
Hey, come on, come on.
To the left now. To the right. Now take your left hand and put it on your side. Go over your shoulders. You slip and slide.
Count it.
Part's my favorite part.
Watch it.
Gonna do the twist and cowboy.
Come on.
Sweet heart, it's been out with. Go down and get
Come on.
take the left now and dip. We're gonna go down, take a sip, we're came back with your feet. Sing, you second number.
Watch it.
Fly to the left,
Okay.
to the right.
Five.
Have a good time.
4,
Fly to the right.
3, 2, and 1.
Round, round,
Great.
round you go.
Great job. Great job. I want to say, y'all need to send out letters to Emory for this presentation. And I want you to write a good note and say how much you appreciate the entire program. Hey, I'm John Lewis, and see you later. Bye.
Wow. Okay. Excellent. Hey, I hope everyone is moving and feeling energized and ready to go, and you're all pumped up and your heart's going and you're feeling good about today and yourself. So thank you, John. We really appreciate you every week joining us and getting us moving and motivated. So next up, I just want to welcome you again to the 175 people who are online with us right now. Welcome. Next up, you're going to hear from Dr. Monica Parker. She's going to be sharing some updates about research. We are a research center. I mean, we are hearing a lot now about COVID-19 and vaccinations and all that, but she's going to really explain to you our process as a research center and what that looks like, as well as current research projects. So Dr. Parker, if you want to introduce your topic, it takes me about a minute to pull up your slides.
Well, good afternoon, and thank you to all 178 of us who are continuing to stay on our webinars each week. We're really grateful that you have tuned in, and this is our way of keeping in touch with you and keeping you as engaged as you can be. The Goizueta Alzheimer's Disease Research Center is very busy and very active in looking for a treatment, a definitive treatment for Alzheimer's and related dementias, but Alzheimer's in particular. To that end, we need a number of healthy, and that's most of you on this call, because if you didn't have the abilities, you wouldn't have been able to log into Zoom and get on. Our research focus is less on people who actually have the disease and looking more now at people who don't have the disease but might have risk factors that put them at, may position them to get Alzheimer's a little bit later on. Alzheimer's, as we've talked about before, is a genetic disorder, unlike vascular dementia, which is related to strokes and lifestyle. So the Alzheimer's, which is incredibly debilitating, is something that we are working on finding a cure for. In lieu of a cure, we are looking at things that we can do to prevent Alzheimer's and related dementias. And that's why you have the focus on exercise and diet and all of those things that we've been stressing that have to do with health. That being said, the Goizueta Alzheimer's Disease Research Center is very much focused on looking at healthy people, not people who've necessarily, not just people who have the disease, but people who don't have the disease and are clinically independent and functioning well. But let's just say your mother actually had Alzheimer's. My mother has Alzheimer's, so I know that I have a gene somewhere that puts me at risk for Alzheimer's. But if I do what I'm supposed to do in terms of keeping my weight down, staying physically and socially engaged, I'm not likely to suffer from Alzheimer's in the way that my mother is. So I want you to listen to everything that you hear. I want you to participate in clinical research here. People are going to ask about drug trials and what's involved in all of that, and hopefully I'll go through some of this. Some of this you've heard before, so if you've heard it before and you're knowledgeable, quiz yourself as we go along. Next slide, please. What are the different types of research? What's clinical research? Well, the National Institutes of Health defines clinical research as research that's conducted with human subjects. Human subjects can be their tissues, blood specimens, biomarkers, things like cerebrospinal fluid, spit, saliva, urine, and where you study, where there's a direct interaction between you, the study subject, and the investigator. The different types of clinical research are things that are patient-oriented research. You can read that, that's self-explanatory. Epidemiologic and behavioral studies, we may give you a quiz to say, what are you eating? What are you drinking? What are your exercise habits? Those are kind of behavioral studies. And then outcomes and health services research. This doesn't necessarily have to do with you as an individual, but it's a look at, let's just say, hospital records. How many people have been admitted to the hospital with this disorder or that disorder? This helps us identify the most effective interventions, treatments, and services that might be needed by any individual. Next slide, please. We're going to focus on patient-oriented research here. Here at the Emory Goizueta Alzheimer's Disease Research Center, we have a number of different studies going on. These studies may be long-term studies of changes that occur or healthy aging studies. That means that we're going to be looking at you over a period of time. We're not doing anything to you. We're just going to be studying things. So you can be here from the time you're 65 until the time you're 105 as part of our aging study. Clinical trials for prevention or treatment of Alzheimer's and mild cognitive impairment. There are interventional studies that are under development. They're not ready for prime time, which means you can't go to a store, drugstore, or go to a doctor and get a prescription for them. Those are clinical trials that involve drugs. Some of the drugs are intertherapeutic drugs like aducanumab, which is a new drug, but was studied a couple of years ago, but it's about to be released by the FDA for public availability. And there are studies that we're doing that repurpose medications. A lot of the blood pressure medicines, we hear we're studying high blood pressure and cardiovascular disease and their relationship to dementia. Well, some antihypertensive medicines, as you've learned from Dr. Wharton, are a little better at protecting your brain from the ravages of hypertension. And then finally, we're looking at pilot studies. We're looking at biomarkers, things in your blood, things that are in your saliva, things that are in your cerebrospinal fluid that may indicate that you are at risk for developing some kind of neurologic degenerative disorder. Next page, please. So we want you to get involved. We have research interest forms, but when we're in person, we get those. But right now, we do have online forms. We want you to look at our website, our www.emory.alzheimers.edu website. That's going to be at the end of this presentation. And fill one out, call somebody, and get involved and get engaged. If you are a patient being seen by any of the neurologists here at the Brain Health Center, we have studies, the different clinical studies that for which you may be a candidate for are likely to be offered to you. But if you're in the medical clinic, in the neurology clinic, or even the geriatric primary care clinic, you may be given an opportunity to participate in a clinical research study. Clinical research is going on in just about every medical department here at Emory. Go on. So what will we be asked to do? Different studies require different things for their, whatever it is they're studying. Some of the studies require you to fill out a questionnaire online every year, and they may have somebody call you and ask you to do something. Some of these different studies may ask you to do a little bit more than fill out a questionnaire. We may ask you to fill out a questionnaire, take a medical history. We may take some blood from you, we may swab your mouth for genetics. We may do an x-ray. Over there on the right, you see a picture of the brain, a special kind of x-ray, a brain MRI or a brain PET scan, and any other kind of specimens. One of the nursing studies is looking at fecal material to look for things that may be protective. So any of those things can be a part of a study. Every study is different. So if you're interested in a study, ask them what is going to be required of you, because all studies don't require the same things. And you may even get some compensation for travel or for some, whatever it takes for you to be involved in the study. And each study will be able to tell you what's involved and what you get for doing what, because that's always a question. Am I going to get paid for doing this? We don't like to say we pay you for research, but you will be compensated for your time, certainly travel, food, things like that. Next page, please. Next, I think I've gone through most of that. Okay, so when you enroll in a study, what's involved? Okay, you're going to meet with a coordinator who's not necessarily the investigator. For our study, iConnect, which is a social engagement study, you would meet not with me, but you'd meet with Crystal Davis, who's our coordinator, who would inform you about the study and get your permission to participate in the study. Study is a volunteer activity. It's not something you're required to do. We ask your permission to join. We get you to sign on the dotted line. And if you don't want to participate anymore, you can stop at any time. But generally at this initial visit, we'll ask you a number of questions. You'll complete some documents, and we'll look to see that you meet eligibility criteria. So if the study calls for a 65-year-old woman and you are a 70-year-old man, you are not eligible for that particular study. There may be another study you're eligible for, but not that one, because first of all, you're over the age of 65 and you're a male, not a female, okay? Many of these studies require you to have more than one particular visit. Some studies may require just that initial face-to-face consent visit, get a specimen, and that's it. And you may get a gift card. Some of the studies may require that you come in, get your consent, come back at another time, get scheduled for a PET scan, come back at another time and get scheduled for a lumbar puncture or some other procedure like monitoring your blood pressure. Different studies have different requirements and have different steps and different visits. At the start of each study, if you've been eligible and you meet all the criteria, the coordinator will tell you what's expected of you when you're to come back, and you should get all of that information from that one coordinator. You don't have a whole bunch of people calling you and checking on you to do things. You have one coordinator, and that's for familiarity and for continuity. That's what we call it. But more importantly, any question that you have about a research study should be answered by your coordinator. Next, please. Why don't we have enough people participating? A lot of people haven't necessarily known about different studies, and there are some studies that we are going to have here that everybody is not a participant for. For a lot of the intervention studies, for a lot of the drug studies, you should have already been evaluated and diagnosed with Alzheimer's by your neurologist, and your primary care doctor is aware of that. And if you've been given a definite diagnosis of Alzheimer's, chances are you have already had a brain MRI, you've already had a lumbar puncture, you've already had genetic studies that basically confirm that you have Alzheimer's and not some other kind of disorder. So if, excuse me, you're in you filled out information about a particular study and you say, I didn't get called back, nobody called me back, it's real important for us to be able to get in touch with you. So make sure that your email address, your telephone number, et cetera, are correct. But more importantly, if you called about a particular study, and as I said in the last slide, if you didn't meet the inclusion criteria, you might not be called back for that one, but we're going to try to put you in the kind of study that is appropriate for you, given your age and what your interests are. Next, please. Next. Okay. There's a word on the screen that says screen fail for a study. That means that some part of that eligibility inclusion criteria is something that isn't appropriate for you. So for that particular study, you may not be appropriate, and we'll have to offer you something else if we have it. But for that particular study, you may not be able to participate any further, I should say. What happens if I'm not eligible for any studies? We have a number of studies every year that are offered. And for most of what we have here, I will say that the Emory Healthy Aging Study is probably one of the least risky studies for any of us. It's online. You fill out a questionnaire about your lifestyle. There's no blood. There's nothing that you have to come in for. It's online. A certain subset of people who participate in the Healthy Aging Study will be invited to the Emory Healthy Brain Study or longitudinal brain studies, but we will refer you to other studies as you are appropriate. So the interventional studies are not necessarily for everybody, so don't be offended if somebody says, well, you're not eligible for that study. Ask them what else I can possibly participate in, but everybody on the call is eligible for the Emory Healthy Aging Study. Next, please. If you change your mind, research participation is a voluntary activity. There's no penalty for you withdrawing and deciding you don't want to go any further. You don't have to be in research. Research participation is optional. It's not something you must do in order to get treated for anything anywhere, okay? If you don't want to be in a study, you don't want to be in a study, and there's nothing we can say or do that forces you to change your mind about that. But keep in mind, clinical research or any kind of research is optional. You choose to participate. We're not forcing you, and any medical treatment you may get is going to be given to you whether or not you participate in a clinical research study. Next, please. What sorts of things should you be aware of when you enter into the study? You need to be aware of whether or not you're able to participate in one study here, and make sure that that study doesn't keep you from participating in another one. Make sure that you're aware of what the study schedule is like. You remember when I told you initially, when you start talking to the coordinator should tell you how many different visits are required. One of our study visits requires like 3 visits, an initial visit and a second visit to check data and a third visit to give you the results of that data, that they collected. So if what they propose doesn't meet with your schedule, you are under no obligation to continue participating. But when you do participate in a study, you should ask the person what's involved, how many visits is it going to take, how long is this going to take. And please appreciate that a lot of the stuff that we find isn't necessarily going to be something that's going to be shared with you. Globally, when we have all kinds of results, we'll share them with you. If there's anything particularly abnormal that's found in the course of your participating in research, we're going to make you aware of that and help you get the resources and help you inform your doctor about what needs to be checked further. Research is not a substitute at all for a medical visit or a comprehensive medical assessment by your primary care provider for medical issues, or by a neurologist if you have specific neurologic issues. Next. The other thing that I should need to tell you is that any of your research visits, if you are an Emory patient, none of your research results or visits are recorded as part of your medical record. Your medical record is separate and apart from your research record. So we pay attention to what your personal data is and your personal interests are, but none of your personal health information or anything you disclose to us in research becomes a part of your medical record. There are a couple of studies that we have here at Emory. You have the Emory Goizueta Alzheimer's Disease Research Center, but I'm going to highlight a couple of studies that are just immediately available for us. Next slide, please. Okay, one of those is the Emory Healthy Aging Study. This begins as an online study. Some people will be asked to go a little further, provide some body fluids, maybe do an x-ray a little bit later, but the Emory Healthy Aging Study, one of our coordinators, Whit, was on talking about the Emory Healthy Aging Study last week, excuse me. This is something that everybody can join, and it's something we're gonna do and ask you questions every year for as long as you choose to participate. Next study, please. Right now, we're participating in a Zoom call. Socialization, social engagement, maintaining social engagement is very important. And social isolation is known to be a risk factor for Alzheimer's and related Alzheimer's dementia in particular. So we have a study. I happen to be the principal investigator. That's what a PI is. And we want people who live alone, who don't live with anybody, to remain socially engaged. If you think that you might be a candidate, please give Crystal a call, 404-727-6696. No, nothing interventional. We're basically giving you an intervention of conversation to talk to you. And we're going to learn more about how conversation and social engagement help improve memory and prevent dementia. Next slide, please. Emerald, some of you may have had an allergy and maybe you were put on a medication called Singulair. It's called Montelukast. Dr. Ehab Hajar is doing a special study to see if Singulair or Montelukast therapy can stop something called neuroinflammation. Neuroinflammation is one of the processes that we observe in the brain in people who have Alzheimer's. So the idea is that we might be able to repurpose this medication, this Singulair, which is generally used for people who have asthma and allergies, can be used to stop neuroinflammation and those changes that go along with Alzheimer's and related dementia. Again, or Alzheimer's, I shouldn't say related dementia, I should say Alzheimer's. This study is called Emerald. The principal investigator is Dr. Ehab Hajar. He is one of our clinicians, and you can reach them at 404-712-6332. That number is there. This is one of our brochures. And again, we're looking at how we might be able to repurpose medications for the purposes of decreasing our risk for Alzheimer's. This is not a cure for Alzheimer's, but this may reduce some of the risk, some of the risk factors that are associated with developing Alzheimer's. That's the Emerald study, and it's for people who are healthy, normal people, healthy cognition, which means you're pretty independently functioning, and maybe even people with mild cognitive impairment. Next, please. Memory, the study for memory at our Goizueta Alzheimer's Disease Research Center. People involved in this study are basically fully categorized, kind of like the Emory Healthy Aging Study. We bring you back at regular intervals annually if you're over the age of 75, between 65 and 75, probably once every 2 years to 3 years. Over time, as part of this study, we ask you to get maybe a brain image. We ask you for blood. But most importantly, every year we're getting you to do memory studies. The good thing about the memory study, this is part of a nationwide study for people here in the United States. We're looking at the trajectory of people who have normal brain health and people who don't. For people who may have something called mild cognitive impairment, which we talked about before, we're trying to look at how long does it take for people who have mild cognitive impairment or MCI due to Alzheimer's to develop Alzheimer's, full-blown Alzheimer's dementia versus not, and what kinds of interventions you might be available for. Being a part of our memory study, we call it, as part of a nationwide study again, you get to check in with other things and you may be offered other studies that you may be eligible for participating in. Again, the memory study, unlike the Emory Healthy Aging Study, you do have to come in and get some testing. In the era of COVID, we're doing a lot of this testing over the phone. The only things that we don't do over the phone would be something like getting our MRI or getting our lumbar puncture. That's memory, and that's a long-term study. We need anybody who's healthy and eligible to participate, particularly people of color, particularly men. Next, please. And for most of our general studies here at the Alzheimer's Disease Research Center, you can call Natalie Zimmerman. There's her number there, 404-712-0212, or Crystal Davis, 404-727-6696. Write those two numbers down. If you're interested in research, please call these young ladies and they will be happy to direct you to where you need to go. There are some calls in the chat asking about some of the information that's on our rounder. We have looping resource guides that will be played near the end of this chat as well, but feel free to ask the information in the chat and in the Q&A. Thank you.
Thank you, Dr. Parker. One quick question. You talked about, abnormal things that happen. Can you tell us a little bit about how an adverse event is handled if you are a research participant?
If you are in a research study and something happens to you, let's just say you came in to give some blood, and when we stuck you, you got a big bruise on the top of wherever it was we took the blood from, and it was painful. We would probably try to administer certainly first aid. If it was necessary for you to go to the emergency room, we would probably take you there. Most side effects or adverse events or things that occur in the course of research are managed by the research project itself. Some things are not. Your usual health insurance will be tapped for that, but for the usual research related things that occur during your participation, the study generally assumes responsibility and will help assist managing whatever that adverse event is. Does that help?
Yes. Okay. And finally, you touched on who do we need most to participate in research?
Everybody.
Yes.
We need everybody, and you'll hear us periodically say we need men. You'll hear us say we need people of color, and that's because they're underrepresented in research. We need everybody to participate in all of our studies. So even if this one's not appropriate for you, maybe there's another one. And I know that most of the people who listen to us every week and join us and come to all of our seminars, most of you are women. And it's not that we don't want women, we love women, but I would just like you, if you're a woman and you have a husband or you have a brother, bring your brother or bring your husband along with you. Bring your adult child with you to enroll as well. But we are in sore need of having more men participate in our research studies, particularly men of color. So if you're Latin American, if you're African American, if you're Native American, if you are Asian American, we need you, particularly if you are men. Thank you.
Okay. All right. Thank you, Dr. Parker. Okay. Next up, we will be hearing from Rebekah Davis with the Alzheimer's Association. And the Alzheimer's Association is just one of our esteemed partners. Not only are they a national organization, but they have boots on the ground in most parts of the state of Georgia. So it's just critical that we share with you today some of the resources and services that they are providing in this environment, especially with budget cuts and everything that's going around. So hi, Rebekah, thank you so much. It's so great to see you here, and you can go ahead and I'll advance your slides.
Hello and good afternoon. Thank you so much. Thank you for the opportunity to join you all today, and of course for the important work that the Research Center is doing every day. We appreciate you guys so much, and thank you for advancing my slides. If you will go to the first slide, thank you. Before I share some information about the programs of the Alzheimer's Association, the Georgia chapter specifically, Ms. Dorban had asked me to provide some information on respite for caregivers, and this of course will be a very brief overview because of our time constraints, but we want to talk about respite because we know that respite can be a very important resource for families who are caring for someone with dementia. And when we are supporting families and caregivers, we often discuss the importance of self-care and how respite is beneficial for both the person living with dementia as well as their caregiver and their families. We know that everyone needs a break, and respite care provides caregivers just a temporary break or rest from caregiving. And at the same time, the person with dementia is able to continue receiving care from someone who is capable in a safe environment. So using respite can support and strengthen your ability to be a caregiver. Respite can give you a chance, as I said, to spend time doing maybe things you need to do or things you want to do, spending time with other friends or family, or just to relax, taking care of running errands. Right now, we know that looks a little bit different because we're all staying home a little bit more than normal. But then you also have the comfort and the peace of mind knowing that your loved one is being taken care of while you get a break, while you step away for a moment. And likewise, as I said, respite care services can give the person living with dementia an opportunity to interact with someone else, to have to be able to spend time in a safe and supportive environment. And again, you as the caregiver know that they're taken care of. Respite can be provided at home by a friend, another family member, a volunteer, or a paid service, or it can be provided in a care setting, such as an adult daycare or a residential care facility. We know right now that during COVID-19, out-of-home respite can be a challenge because some adult daycares are not able to be open. So we know that that's a challenge right now for many caregivers. So families have a few different options when you're seeking to learn more about the types of respite or the respite resources that are available. I've listed just a few here, and I'll briefly mention them. A resource that we often refer families to, and one which we work closely with, is the Area Agency on Aging. You will often hear this agency referred to as the AAA. It's a little bit easier. I had someone ask me once, the AAA, do you mean the car club? I said, no, let me explain. I call it the AAA. It's the Area Agency on Aging. But the AAA network covers the entire state. So there is an Area Agency on Aging serving you wherever you live. And you can find a AAA to help you in Georgia by visiting the Division of Aging Services website, or nationwide. If you happen to be outside of Georgia, you can go to n4a.org and you can locate the closest Area Agency on Aging. Through the Aging and Disability Resource Connection, the AAA is able to really serve as a gateway to community resources for the aging and the disabled. So sometimes you'll hear of the Area Agency on Aging and the Aging and Disability Resource Connection talk, you'll hear them referred to together, but the Aging and Disability Resource Connection, that's a coordinated system of partnering organizations who are serving the aging and the disabled locally in communities throughout Georgia. So they have information on resources, and again, including respite resources. EmpowerLine is another great resource for learning more about respite. This is a service that's provided by the Atlanta Regional Commission that is designed to connect Metro Atlanta's older persons and individuals with disabilities to the information and the supports that you may need. EmpowerLine serves a 10-county region in the Atlanta area. And you'll see the link there. Actually, when you go to the EmpowerLine homepage, there's a link where you can explore opportunities for respite care. We'll talk a little more about the Alzheimer's Association 24/7 helpline in a moment, but I've listed it here because I want families to know that families, caregivers can contact us anytime when you're needing referrals to respite resources. The Alzheimer's Association and AARP Community Resource Finder listed here is a database of dementia and aging related resources that makes it easy for individuals, families, caregivers to find programs and services in a specific location. You can search by your city and state. You can search by your zip code. So that is another great online resource that you can reach out to for finding respite and other local resources. Choosing care providers. Oftentimes families have questions about if I'm looking for an adult day or if I'm looking for in-home respite, what are the things that I look for? What are the questions that I ask? Well, the association has a tip sheet with information specifically on choosing care providers. There's also a plethora of information at our website, alz.org. You'll see that linked here in the PowerPoint. When visiting the site, you'll find information on the different types of respite, again, as I mentioned, including adult day programs and in-home respite. So lots of great information on the website, as well as these other resources listed here. Next slide, please. So next, I'd like to share information on the Alzheimer's Association's care and support programs. Those include, as I mentioned, our 24/7 helpline. We offer care consultations for families and caregivers, education programs. We have early stage engagement programs for those who are in the early stages of Alzheimer's or dementia and their care partners. We also have caregiver support groups. Traditionally, our programs are primarily offered in person, but in mid-March, due to the COVID-19 outbreak, our staff and volunteers shifted the delivery method of our programs, and currently all of our program delivery is virtual. We know that caregiving can be a challenging yet rewarding role. And so as families navigate their journey with dementia, we want you to know that the Alzheimer's Association is available to offer support. Next slide, please. Next slide, please. I'm not seeing it progress on mine, so if it did, I just didn't see it. The next slide should be about our 24/7 helpline. As I mentioned, the association is available whenever families need us via our 24/7 helpline. Our helpline has remained available throughout the pandemic. Over the years, the helpline has been a lifeline to so many families. I'll often refer to our helpline as the foundational program for the association. It's really a great way for people to connect to the association, including caregivers. As I mentioned, families can reach out to us anytime. People in the community who just want to know more about dementia or more about research that's going on in their state or what the Alzheimer's Association does, or maybe professionals needing information. All of those I just listed can reach out to our helpline that is available 24/7. Our helpline is staffed by trained dementia care experts and also by master's level clinicians. And those clinicians can assist families who might be in a crisis or who need a higher level of support. And as I mentioned earlier, as families and caregivers are seeking information about respite, our helpline is available to help. So I always, anytime I have an opportunity to share about the association's programs that we offer, I always mention the helpline because I know how important this service, this program is to so many. Oftentimes we have caregivers that are repeat callers to the helpline because you never know if at 2 or 3 o'clock in the morning, you just need somebody to talk to. That's when our helpline is available, but we are always here to offer support. Next slide, please.
And Rebekah, for the people who are calling in, will you tell them the 800 number?
Yes. Thank you so much for mentioning that. Yes, our helpline number is 800-272-3900. Again, that's 800-272-3900, and that is our 24/7 helpline. Yes, thank you for mentioning that. So as I mentioned, we are currently offering virtual programs throughout the state. You may have seen a couple of our flyers rotating at the beginning of the program that were shared earlier today. So thank you for sharing those. Due to COVID-19, all of our program delivery is virtual. So we have made that shift and are meeting that need for those who are able to take advantage of those learning opportunities. We are offering a monthly calendar of virtual education events, which include talks on topics such as the early warning signs of Alzheimer's, tips for communicating with someone with dementia, legal and financial planning for persons with dementia and their care partners, and several other different topics that we offer. And I should mention here that our education programs have something for everyone. Some of them are tailored for family caregivers, and others are tailored for general audiences. One example is our Healthy Living program. It's a great program for general audiences. It includes information that we all need to know regarding brain health. So basically, this program is good for anyone with a brain, and we know that that is all of us. I love Mr. Lewis's presentation at the beginning, because in Healthy Living, we talk about staying physically active and exercising. And I thought, you know what, if he can't motivate you, no one can. That was amazing. Another critical support program offered by the association is our caregiver support groups. Many of our support groups throughout Georgia, thankfully, have transitioned to either a virtual or a telephone format since March. And we're so grateful to our committed support group facilitators for offering this critical program in communities statewide. And then lastly, our early stage engagement, we have something called the Carpe Diem Club. And that is our early stage program at the Georgia chapter. Carpe Diem is a community of Georgians who are living with a diagnosis of dementia and those who love and support them. And they meet to learn from each other, to share, to support each other, to engage, to have fun with each other. And thanks to our enthusiastic, amazing volunteers and staff, all aspects of our early stage engagement program have moved to a virtual environment. And this includes our monthly luncheon. They have a picnic virtually, support groups for the person with the disease as well as their care partners, gentle yoga. And we also have a program called Musings Together, which is an interactive art appreciation offering in partnership with the High Museum. So some really fun things, cool things going on with our early stage program. And then I will wrap it up by sharing contact information for the association. Again, our website is alz.org/Georgia, spelled out. And then our helpline is 800-272-3900. And my email address is listed here as well. Again, I'm Rebekah Davis with the Georgia chapter of the Alzheimer's Association. My email address is rdavis@alz.org. So again, thank you so much for the opportunity to share with you. And that is all from me for today.
Okay, wonderful. One question. So it says Alzheimer's Association, but what about other dementias? How are you all serving individuals or care partners that may not have the diagnosis of Alzheimer's?
So most people don't know this, while we're called the Alzheimer's Association, legally our name is, and I might not get this right, but it is Alzheimer's and Related Disorders Association. So we provide programming and services for caregivers and those living with any type of dementia. So if you're a care partner for someone, whether it's vascular dementia, Lewy body, frontotemporal, whatever type of dementia, we provide care and support programs for you. So that can be a little tricky because we are called the Alzheimer's Association, our public facing name, but we do provide services for and support for any type of dementia.
Excellent. Okay. Wow. Thank you so much, Rebekah. We've been working with you all for decades, but every time there's a presentation, I learned something. And so I just want to reiterate, all their programs are virtual. So you have an opportunity to partake in all of these offerings right from your home. So a PDF of the slides will go out. So when it goes out, download it and share it with anyone who you think could benefit from it. All right. Well, thank you, Rebekah. There may be some more questions in the chat. We're going to close with our final presenter, Erika Henderson. Welcome. Thank you so much for joining us today. And I am going to stop the share here and bring Miss Henderson on the screen. She's going to be sharing with us information about Good Samaritan. So tell us all about the program and the services, all in 8 minutes.
Okay, so my name is Erika Henderson, and I represent the Good Samaritan Health Center. We're located in Atlanta, Georgia, off of Dunley Hollowell Parkway. We are a healthcare facility. We offer medical, dental, counseling, mental health, patient education programs, and we do accept insurance, but we also have serve the patients that have no insurance or low income and can't afford insurance, and we do it off of a sliding scale fee. So how that works is if you're our target priority zip codes are 30318 and 30314. However, we don't turn anyone away. So how we do that is if you're in 30318 and 30314, you can call into our center, and I'll put the notes in the chat for the contact number. You can call into the center and tell them that you want to schedule. Also on our webpage, we have where you can just go on and register to be a patient if you reside in those 2 zip codes. If you reside in the outside of our priority zones, we have new patient intake on designated months and designated days, and then you would go online and do it. Either next new patient intake for non-priority zoning will be in August, and you'll just go on our website, which is goodSamAtlanta.org, and you will register to be a new patient. It is lottery based. Once the slots are filled, then what happens is the message will come up that you have to wait until the next time. As far as resources towards COVID, we have a site with CVS that does rapid COVID testing. However, because of the demand for testing, right now we're only allowing any person you have to be like symptomatic, and then you have to either have no insurance and reside in 30318 and 30314. So if you have symptoms and you don't reside in those areas, but you don't have insurance, you can call our number to get tested, and we'll call you back and they'll schedule you. Right now, we're running out about 2 days. Our schedule is filling up. So like if you call in today and wanted to get tested, it'll probably run you to about Thursday, maybe Friday to get tested, because testing is in such high demand. But if you also come to the clinic and you don't meet our criteria to get tested at our CVS site, we have a list of resources that we could give you to show you where you could get tested, as well as we have on our website to show like what we're doing for COVID-19 and other resources that you can use to get tested.
Awesome. And so what when you say appointments and scheduling, what types of services? I know you also provide dental services as well. What are some of the key services that Good Sam is providing?
So we have medical, we have dental, we have counseling, mental health. We see children. We have a pediatric. Our founder is actually our pediatrician that he sees patients throughout the week. Right now, he's only seeing patients on Tuesday, Wednesday, and Thursday because of our schedule has kind of scaled back due to the pandemic. We also have certain specialists right now. Some of our specialists have started coming back into clinic. For instance, we have this organization called Prevent Blindness that we work with. We have a diabetes foot clinic specialist. We have a gastroenterologist. We have like women's specialists, like for that's gynecologists, especially is specialized in like certain cancers for women, like cervical cancers. We partner with Northside and for them to send out a mobile mammogram unit where we're able to like sign people up to come, and the mobile mam comes to the clinic and people are able to come to our clinic and get their mammogram done in the mobile mam unit. We have, we partner with Lighthouse to give patients eyeglasses at a lower scale. So we have a variety, like a wide variety of services that we offer. And what I also can do is get a flyer from our marketing guy and send it over to you so you could share with everyone.
Excellent. Okay. All right. Well, that about does it for us, everyone. Thank you guys for joining us again. Every week, we're bringing you lots of information. And as I mentioned, the PowerPoint slides will be available. A PDF will be sent out, as well as a recording so that you can go back and watch the information again. So when we send this out, make sure you download it, make sure you go through all the content. If you have questions, send those over. And we look forward to seeing you back next Tuesday. So thank you again and have a great rest of the week. Stay cool. I hear there's a heat wave. Even with COVID going on, we need to still be diligent, wear our mask, wash our hands, keep our distance. And we look forward to seeing you next week. Thank you, everyone.